Biotin is one of the most purchased supplements in the world for hair loss. It's also one of the ones with the least clinical evidence for most of the people buying it. Today, we are going fully into all things biotin, what biotin actually does, who it genuinely helps, and the part nobody talks about that is a real patient safety concern. If you've been taking biotin and wondering why nothing is happening with your hair, this video is for you. If you've also been seeing a lot of dermatologists talking about why biotin is not helpful and you're curious as to why, this video is also for you. Hi, I'm Dr. Amina, a triple board certified dermatologist. If you are new here, welcome. I focus on evidence-based skincare and longevity-focused wellness, and biotin is an ingredient that I've spent significant time researching and presenting on clinically. So biotin is vitamin B7. This is a water-soluble B complex vitamin. It's a cofactor in macronutrient metabolism, meaning that it helps your body process carbohydrates, fats, and proteins. And it supports keratin synthesis, keratin being the structural protein that makes up your hair, skin, and nails. So that connection between biotin and keratin is real, and it's the biological basis for all the marketing that you see behind biotin. Where does biotin come from? Well, you can find it in meat, eggs, dairy, nuts, and seeds. These are the primary dietary sources. And then there's plant sources, sweet potatoes, legumes, some seeds that can also contain some meaningful amounts. And here's something most people don't know, that your gut microbiome synthesizes biotin as a byproduct of normal bacterial metabolism. So a healthy gut microbiome is actively contributing to your biotin status. This is why true biotin deficiency is uncommon in people with a varied diet and a healthy gut. The most clinically significant cause of deficiency is biotinidase deficiency. This is a rare genetic condition where the enzyme that recycles biotin in the body does not function properly. So if you don't have that enzyme, biotin can't be reused and levels will drop. And then beyond that, biotin deficiency is largely a nutritional or absorption issue rather than a primary dietary gap for most people in developed countries. You are probably not deficient in biotin. You are probably just being marketed to very effectively. Now we're going into the evidence behind biotin. Let me give you an honest tiered breakdown of what the research actually shows. So tier 1 is where we have strong evidence, and this is for true deficiency states. In people with genuine biotin deficiency, so biotinidase deficiency, severe malnutrition, prolonged IV nutrition without supplementation, or conditions causing significant malabsorption, biotin supplementation produces rapid and consistent improvement in hair, skin, and nail symptoms. The evidence here is clear and the clinical response is real. Tier 2, this is where you can get possible benefit in certain healthy appearing people. So this is where things get more nuanced. Some people may have partial biotinidase enzyme deficiencies that haven't been formally diagnosed, and then others have functional biotin depletion from specific circumstances. Did you know that raw egg white consumption over time can cause biotin deficiency? So raw egg whites contain something called avidin. This is a compound that binds biotin and blocks its absorption. Now there's also people who are on long-term antibiotic use. This can disrupt the gut bacteria that synthesize B vitamins. Then there's also people who take medicines for seizures. These include things like valproic acid, phenytoin, carbamazepine. These can interfere with biotin metabolism. And then there's isotretinoin, also known as Accutane. This can affect biotin transport and decrease levels. We can also find lower levels of biotin in people who drink alcohol chronically, people who are pregnant, or people who have a higher demand for biotin. So if you're in a high inflamed state, this can lower your biotin levels. And one of the problems here, we don't know if people are truly deficient in biotin because the tests to measure biotin aren't super sensitive, so we can't rely on those. Next is tier 3, where there's limited evidence for replete healthy adults. Now, for the vast majority of people buying 5,000 micrograms of biotin gummies, people who eat a varied diet and take no disruptive medications and have a functioning gut, there are no large randomized controlled trials demonstrating benefit for hair loss. For brittle nails, there are some uncontrolled trials suggesting modest improvement. I think the nail data is somewhat better than the hair data, which is worth knowing. But the bottom line is, if you're not deficient, you're not going to grow more hair by taking more biotin. Water-soluble vitamins really don't work that way. The lab interference problem. Patient safety. Here is what I consider to be the most underappreciated and genuinely dangerous consequence of high-dose biotin supplementation, and it has nothing to do with hair growth. High-dose biotin at the doses found in most OTC supplements, typically 5 milligrams or higher, which is over 100 times the daily requirement, can interfere with multiple laboratory tests. So this can include thyroid function tests like your TSH, your free T4, free T3. These can read falsely elevated or falsely low. Now this other lab test is scary. This is troponin. This is the cardiac enzyme marker that we test to diagnose heart attacks. High-dose biotin can actually cause troponin levels to read falsely normal. So theoretically, you could have a heart attack, but your lab tests say that you're not. High-dose biotin can also affect other hormone assays. These include like your pregnancy test, parathyroid hormone, cortisol, and other hormone tests. And this is not theoretical. There have been documented cases where patients supplementing biotin had troponin assays that returned falsely normal during an actual cardiac event. The FDA issued a formal safety communication about biotin interference in troponin testing because of this. This is critical. If you are taking biotin supplements and you need blood work, especially a thyroid function test, cardiac enzymes, or any hormone testing, I would stop biotin 3 to 5 days before your labs, and please tell your doctor you've been supplementing. This is not optional safety advice. Taking a hair supplement that makes your cardiac test look normal when it isn't is not a trade-up I am comfortable recommending. But when does biotin actually make sense? With all that being said, there are specific situations where I'd recommend exploring biotin supplementation. Biotin is worth considering if you have suspected or diagnosed biotinidase deficiency or malabsorption condition, if you've been on prolonged antibiotics that disrupts the gut microbiome that synthesizes B vitamins and the biotin status can be genuinely affected. If you're on anti-seizure medicines, isotretinoin, have significant alcohol use history, all of which can deplete biotin. If you're vegan or have a highly restrictive diet, while plant sources of biotin exist, people with very restricted intake and concurrent gut dysbiosis may have lower biotin availability than they'd expect. If you're pregnant or if you're in a high demand metabolic state, biotin requirements increase and dietary sources may not keep up. If you have brittle nails alongside hair concerns, nails respond more consistently and reliably to biotin supplementation than hair does. And if you have signs of chronic systemic inflammation or an autoimmune condition, high metabolic demand from inflammatory states can create relative biotin depletion. And then one final note, biotin can trigger acne in acne-prone individuals, possibly through competitive displacement of pantothenic acid, which is vitamin B5, which plays a role in sebum regulation. So if your skin has broken out since starting a biotin supplement, that is a real and documented connection. So what actually works for hair loss? If you've been taking biotin and your hair isn't improving, here's the correct next step, and it starts with evaluation, not more supplements. First, see a dermatologist for a proper scalp and hair evaluation, as well as a thorough medical history. The type of hair loss matters enormously for treatment. Androgenetic alopecia, telogen effluvium, and alopecia areata all have different drivers and different solutions. So treatment before diagnosis is guesswork. A dermatologist will examine your scalp, your hair density and pattern, and determine what's actually happening before ordering anything. Many dermatologists will order labs, but labs to look for are things like an iron panel, including ferritin, because ferritin below 70 is associated with hair shedding in women even without anemia. Also look at vitamin D, zinc, and a full thyroid panel. What about supplements with actual multi-mechanism evidence? We have things like Nutrafol and Viviscal Pro. They both contain biotin at appropriate doses, but they work through meaningfully different mechanisms. Both Nutrafol and Viviscal Pro contain hydrolyzed marine collagen, which is their core ingredient. Nutrafol's differentiating ingredients include things like saw palmetto. This is a 5-alpha reductase inhibitor that addresses androgenetic alopecia. It also has ashwagandha to help with stress-related hair loss, and it has anti-inflammatory ingredients like curcumin. Viviscal has a very proprietary hydrolyzed marine collagen as their amino mar collagen, and they also take more of a nutritional and structural protein approach. Both Viviscal and Nutrafol address different root causes and can be genuinely complementary to your hair care routine. And they're both very different from taking like a single ingredient biotin gummy at 5,000 times the daily dose. For clinical level treatment, I have a full video on female hair loss treatment linked in the description box below. In this video, I do a deep dive on all the treatments for hair loss, including minoxidil, spironolactone, ketoconazole, PRP, and a lot more. So please watch that for the complete clinical picture on how to address hair loss. In this video, I talk about treatments that have far more robust evidence for the most common types of female hair loss than any supplement, and they should be part of the conversation if your hair loss is significant. So I want to say that biotin isn't a scam. It's a legitimate B vitamin with a real role in keratin synthesis. The problem is that it's been marketed aggressively to a population that largely doesn't need to supplement it at doses that create real lab interference risks without the context that actually makes it useful. If you're taking high-dose biotin and you have upcoming blood work, please remember to stop it 3 to 5 days beforehand. And remember to tell your doctor. That's the most important practical takeaway from this video. And if you've been taking it for hair loss without results, please get a proper evaluation, get the right lab tests, and consider whether a multi-mechanism supplement or a clinical treatment is the more appropriate next step for your specific situation. Everything I mentioned is linked in the description box below, including my full hair loss video. A like helps us reach more people, and subscribe if you want more evidence-based content like this. Thank you so much for watching, and I'll see you in the next one.